Fine. I'm the local chapter chair of our New York Metro chapter of Physicians for a National Health Program, and we're really very, very pleased that you could all join us this evening. I regret to announce, however, that this afternoon we got a call from Donna Smith that she had fallen ill. Actually, I don't know how public this is and whether I'm violating her, but she's really just could not come up here tonight. However, she is going to join us on the telephone tonight, so if you can be imaginative about her presence here, she will be with us. And I'm going to, at this point, introduce our moderator for the evening, who is Dr. Carmelita Blake. She is at NYU, where she is a professor. Her background is initially in nursing and now is actually in healthcare management teaching at NYU. And she is on the board of our New York Metro chapter. So please welcome Dr. Carmelita Blake.
Wait, do we not want to have Donna on the phone?
Good evening, and let me continue extending our thanks that you could join us. As Ali mentioned, our speaker is unable to be here because of illness, but I am sure that she is among us in spirit. Donna Smith is, of course, best known for her appearance as one of the subjects in the documentary made by Michael Moore, Sicko. If you haven't seen it, this is your opportunity to actually go see her, even though not in person, so that you can have a visual as what she looks like. She was included in the movie after returning home to Denver in 2006, where she and her husband were forced to really live in the basement of their daughter's home after they lost everything they had because of major illnesses and surgeries, although they were fully insured. Donna is a Phi Beta Kappa graduate of Colorado College with a degree in history. Her journalism career includes 15 regional awards from the Associated Press managing editors and the Inland Press Association's top honor in 2006 for community-based journalism. Since 2007, she has co-chaired the Progressive Democrats of America's National Healthcare, Not Warfare campaign. And she has so far spoken in 43 states and the District of Columbia about single payer, an issue that is very close to our hearts, as well as healthcare reform in general. In May 2009, Donna appeared on the PBS program with Bill Moyers in the program that he presents, Bill Moyers Journal, to speak about healthcare reform. In 2009, the National Organization for Women, now named Donna their 2009 Woman of Action in recognition of her advocacy surrounding healthcare reform. In October also of 2009, PNHP honored Donna with the Dr. Quentin Young Health Activist Award. Donna presently works and continues to work as a national single-payer healthcare advocate and community organizer for the California Nurses Association and the National Nurses Association Organizing Committee. As a nurse myself, we like to say, even though we're not in practice caring for patients on a daily basis, we remain nurses and we remain committed to caring. Donna and Larry now live in Washington, D.C. area, and they have 6 children and 14 grandchildren. So as Ali mentioned, she will join us by voice. And following the conversation with her, we will have a panel that includes Len Rodberg, Katie Robbins, and Christopher Blair. Christopher is the webmaster and a member of PJMG's steering committee and has been involved in the single-payer movement since he was flyered by PNHP outside Manhattan screaming of sicko. Katie is a national organizer for Healthcare Now, and I think that many people also know her as one of
Donna?
Donna?
That's me.
Okay, hold on one second. We're just finishing up on a wonderful introduction that you just missed, and that was my mistake to not get you on the phone.
Oh, no worries.
But it is being taped, so you will have a tape to see.
Excellent, thank you.
Okay, we're gonna let Carmelita Blake, who's one of our board members, is the moderator tonight. She will finish up, and then we will turn to you.
Thank you very much.
So hold on there.
Katie is one of the Bacchus 8, so if you've been following, she's presently off probation, so we don't really have to worry about her too much. But she continues to still believe that healthcare is a human right, and we have to work to make sure that it is. The other panelists, last but not least, is our own Rodberg, who is the research director for our PNHP New York Metro chapter. So we'll begin with Donna, and then following the conversation with her, we will have the panel.
Good evening, everyone. Can you hear me okay?
Yes.
Wonderful. First of all, let me tell you all how sorry I am I'm not right there in the room with you. I'm sure you've had it shared with you. I've had a little bit of a medical setback, and I'm having to deal with that. And it was very sad for me that the timing of it happened this way. I was so very honored when Dr. Fine called me and invited me to speak to all of you. I'm very fond of PNHP and very fond of Dr. Fine, and wanted to be there with you, so please accept my apologies for not being there. Our topic tonight is such an important one, isn't it, for all of us? You know, where do we go from here? Where do we go as single-payer supporters, as people who believe and know that the way to solve this healthcare crisis is not to move towards more profit-driven medicine, but to drive it more towards patient and doctor-driven medicine? And so I came up with a couple of areas I think are important to talk about as we go forward. I mean, obviously, first of all, we don't know at this time whether or not bill is going to pass through this Congress today. We all know is very important because of the election in Massachusetts and because of the silliness that is the rules in our Senate that make it so absolutely stunning that one senator can have power over whether or not this Congress passes legislation, whether it be healthcare legislation or something else. But whether or not this Congress passes anything and what it looks like is certainly not assured at this point. But what we all know for certain is that it's not single payer, obviously. And we all know that it's a long way from single payer, and in many ways doesn't move us even in the direction that we want to go. And yet I work, as you know, for the California Nurses Association, the National Nurses United, now 150,000 members strong, as we've merged with the Massachusetts Nurses Association and with United American Nurses. And we share with the doctors of PNHP a frustration because, you know, there are some limited parts of this legislation, very limited parts, that may help some patients access some care that they wouldn't have been able to otherwise.